now, most of us know that Viagra is used to correct erectile dysfunction. But did you know that taking Viagra sometimes could cause problems with your vision? That's the topic of today's discussion, and Dr. Charles Flowers is here this morning. You know, that never would have occurred to anybody. I think we were all surprised to hear that. So how does this happen?
Well, actually, in the preclinical and clinical studies that they did during the FDA trials for Viagra, they did find that there were some transient visual side effects, mostly related to light sensitivity and blue-tinged vision, would only last temporarily. This recent study, there was a report just recently published in the March 2000 Journal of Neuro-Ophthalmology where they reported on 7 cases of men who actually developed severe visual impairment following taking a Viagra, usually within 36 hours of taking the medication. So they think that because of the close association, that seems to suggest that there may have been an association.
Was there any other link between these men? Did they suffer from any other problems that may have contributed?
One of the major associated risk factors is that every single man that developed this problem actually had significant cardiovascular risk factors. They all had hypertension, hyperlipidemia, and a number of them had diabetes as well. So there seems to be an association with it seems to be that men who have significant cardiovascular risk factors, i.e. hypertension, high lipids, and diabetes, may be at risk for developing visual impairment while taking Viagra.
Is there something that is in the drug that doctors believe is part of the problem? I mean, is there a certain chemical or something that's in the drug that could be the cause of that?
Well, we don't know. I mean, it's all speculative. We do know that Viagra does alter the blood flow of the eye and as well as other organs of the body as well. So those alterations in blood flow, to what extent that it causes, we're not sure, but we do know it appears to be an association with the cardiovascular risk factors and taking this medication.
Okay, so you said though that when those things happen, the blurred vision and the blue tinge, those things don't last forever. I mean, they're temporary, but is there maybe fear that if you use Viagra over and over again that they could become permanent damage?
No, not the ones that not the ones that in terms of transient visual changes like the color discrimination and as well as the light sensitivity. In all the preclinical studies that were done as well as the clinical studies, there was no findings or any visual side effects in terms of long-term effects that were found on the vision, and that was studied pretty systematically in the preclinical studies or during the FDA trial studies.
So obviously it is important for people taking that drug to be careful, talk to their doctors, and make sure they report any problems that they might have.
Absolutely, particularly men who have significant cardiovascular risk factors, i.e. hypertension, high lipids, and diabetes.
All right, Dr. Charles Flowers, we enjoy having you here on our show regularly, so come back and see us.
Sure will.
Thank you.